G-Tron Ped is a combination medication used to temporarily treat symptoms such as cough, chest congestion, and stuffy nose caused by the common cold, flu, allergies, hay fever, or other breathing illnesses like sinusitis or bronchitis. Guaifenesin helps to thin and loosen mucus in the lungs, making it easier to cough up, while dextromethorphan is a cough suppressant that reduces the urge to cough. This product also contains a decongestant to relieve stuffy nose symptoms. It's important to note that this medication is usually not used for ongoing coughs from smoking, asthma, or other long-term breathing problems, unless directed by your doctor. Additionally, it is not recommended for children under 6 years old, and some forms of the medication are not recommended for children under 12 years old. It's crucial to carefully follow the dosage directions to decrease the risk of serious side effects and not to use this product to make a child sleepy. Also, be cautious about giving other cough and cold medications containing similar ingredients. It's always a good idea to ask your doctor or pharmacist for more details about using this product safely. And remember, these products do not cure or shorten the length of the common cold, so it's essential to explore other ways to relieve cough and cold symptoms, such as staying hydrated, using a humidifier, or using saline nose drop/spray. When taking G-Tron Ped, it's important to carefully follow the directions provided on the product package or by your doctor. You can take the tablet, capsule, or liquid form with or without food, and be sure to drink plenty of fluids unless directed otherwise. This can help loosen mucus in your lungs. If using the liquid form, use a medication measuring device to measure the prescribed dose, and if it's a suspension, be sure to shake the bottle well before each dose. If you're using sustained-release tablets or capsules, swallow them whole and do not crush or chew them, as this can affect the way the medication works and may increase side effects. The dosage will vary based on your age, medical condition, and how you respond to treatment. It's important not to misuse this medication, as doing so can result in serious harm. Avoid increasing your dose or taking it more often than recommended without your doctor's approval. If your condition persists for more than a week, worsens, or is accompanied by a persistent headache, fever, or rash, be sure to consult with your doctor as these may be signs of a more serious medical issue. Some common side effects of taking G-Tron Ped can include dizziness, headache, nausea, nervousness, or trouble sleeping. If any of these effects last or get worse, it's important to contact your doctor or pharmacist promptly. However, many people using this medication do not experience serious side effects. If you do have serious side effects, such as mental/mood changes, shaking, weakness, or irregular heartbeat, it's important to tell your doctor right away. While a very serious allergic reaction to G-Tron Ped is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. As for the optimal timing and daily dosage of G-Tron Ped, it's best to follow your doctor's instructions. They will have determined the best dosage for you based on your specific needs. If you have any concerns about the medication, be sure to discuss them with your doctor. Before taking G-Tron Ped, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. Also, discuss your medical history, especially if you have breathing problems, diabetes, eye issues, heart problems, high blood pressure, kidney problems, overactive thyroid, or trouble urinating. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, as they can increase this effect. Refrain from driving or using machinery until you know how the medication affects you. If you have diabetes, alcohol dependence, liver disease, or other conditions, check with your doctor or pharmacist before using the liquid form of G-Tron Ped. Older adults may be more sensitive to the side effects, so be cautious of dizziness, difficulty urinating, fast/irregular heartbeat, trouble sleeping, confusion, or mental/mood changes. If you're pregnant, only use this medication if necessary and under the guidance of your doctor. Additionally, consult your doctor before using G-Tron Ped if you are breastfeeding. It's important to be aware of potential drug interactions when taking G-Tron Ped. Make sure to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Your doctor can advise you on when to start or stop taking this medication if you are currently taking MAO inhibitors. Additionally, be cautious of products that may interact with G-Tron Ped, such as rolapitant. It's also important to check the labels on all your medications carefully to ensure you are not taking multiple products with the same ingredients. If you are unsure, consult your pharmacist. Lastly, be aware that this medication may interfere with certain medical/lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are using G-Tron Ped. If someone has taken too much G-Tron Ped and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include agitation, confusion, hallucinations, and seizures. G-Tron Ped is used to treat symptoms of gastrointestinal disorders such as diarrhea, indigestion, and stomach discomfort. It is typically taken orally with a full glass of water. The dosage and frequency of administration will depend on the individual's condition and medical history, so it's important to follow the instructions provided by your healthcare provider. It is generally recommended to take G-Tron Ped at the first sign of gastrointestinal discomfort, or as directed by a doctor. It can be taken with or without food, but it's best to avoid taking it with dairy products or calcium-fortified juices, as they may reduce the effectiveness of the medication. Always consult with a healthcare professional before starting or stopping any medication. When your doctor prescribes G-Tron Ped, it's important to follow their instructions and not share the medication with others. It's also important to keep all scheduled medical and lab appointments to ensure the medication is working effectively for you. Remember to take G-Tron Ped as directed by your doctor, and if you have any concerns or questions about the medication, be sure to discuss them with your healthcare provider. If you are taking G-Tron Ped on a regular schedule and happen to miss a dose, simply take the missed dose as soon as you remember. However, if it is almost time for your next dose, it is best to skip the missed dose and continue with your regular dosing schedule. It is important not to take a double dose to make up for the missed one. This medication should be taken at the same time each day to ensure its effectiveness. When storing G-Tron Ped, make sure to keep it at room temperature and away from light and moisture. It's important not to store it in the bathroom or freeze the liquid forms of the medication. Keep all medications out of reach of children and pets. When it comes to disposing of G-Tron Ped, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.